So this is the operating room, and there's not much of skincare that really goes on here, but occasionally we do some procedures in patients who are unsatisfied with the results of just mild treatment, and many people have had some very serious skin disease problems, and they've been left with a great deal of scarring and skin irregularities, blood vessels, pigments, and things like that. And then we have to go on from the milder treatments sometimes to the more aggressive treatments. This is, for instance, a dermabrating head that's used to resand the skin. Most of the skin treatments have to do with removal of the outer surface of damaged area of skin and allowing fresh skin to regrow into the area. It doesn't matter, again, as much whether it's done with a dermabrader, with a laser. We have a high radio frequency unit over here, for instance. So there's or a chemical peel. There are many ways to remove the outer layer of skin. The question is, how deep is it going to be removed, and how well will it heal after that? How deep is the problem? If the problem goes deep all the way through the skin, then the chances of complete removal of it are not very good without damaging the skin and causing scarring. If the problem is superficial, then superficial treatment is appropriate. If you have a mild skin irregularity on the surface, then you don't need deep dermabrasion. You can use a microdermabrader. You don't need a deep laser peel. You can use a mild laser peel. You can use a mild chemical peel instead of a deep chemical peel. As you use the deeper or stronger treatment, your recovery will be longer, but you'll tend to get more of the effect that you want. But likewise, you may tend to get more complications too. In fair-skinned people, deep peeling, deep laser, deep dermabrasion tends to produce hypopigmentation or loss of pigment, meaning they have not enough pigment cells initially, and when they get the damage from the procedure, they lose what they have. Other people who tend to have dark eyes and dark hair tend to create a lot of pigment in damaged areas and may get hyperpigmentation. If either of these processes occur, it can go on for quite a long period of time, and it can prolong the recovery process in its own way. Some patients, depending on what procedure they're having, still need IV sedation. Sometimes when we need to numb up the whole face, we like to have the person come into the operating room and we give them a little bit of IV fluid with some sedatives in them, in which case, of course, you need someone to drive you or help you home. The deeper treatments, we often may apply a mask, a gel dressing onto the face, for instance, that will tend to prevent it from oozing and will tend to act almost as a pseudo skin during those first 3 or 4 days of healing. So skincare can involve light, medium, and deep treatments, and we look forward to treating you.